Welcome to a new session of Ayurveda for Wellbeing. Today's topic of discussion is Nidra, the concept of sleep in Ayurveda, and the session will be taken by Dr. Kamala. So, over to Kamala.
Thank you. Thank you, Dr. Akila. So, are the slides visible? Am I visible?
Yes, yes.
Okay.
Yes.
Okay, so we shall start this session. An introduction to the concept of Nidra or sleep as per Ayurveda. So, the importance of sleep one will realize only when one is not getting sufficient sleep. Just a moment. Yes. So sleep is a very important pillar in life. It plays an essential role in the physical and mental health throughout the life. In fact, it is as important as food to our body. It is during the sleep that the body repairs itself. The regular and good quality sleep is very important for the proper functioning of brain, emotional well-being, physical health, and daytime performances and activities. As we all know, any adult needs 7 to 8 hours of sleep each night to be well rested. But nowadays, we find that people are sleeping very less than they did during the past, and the quality of sleep has also decreased. So, sleep is important for cognition, memory, concentration, performance, as well as productivity. Due to this sleep deprivation, today we see many patients coming in with sleep disorders such as anxiety, depression, stress, poor memory, difficulty in focusing, attention difficulties, sleeplessness, morning headaches, etc. So, what is this sleep, or how is sleep described in an observational and clinical science like Ayurveda, which has been told ages ago? So, as per Ayurveda, Nidra or sleep is a temporary loss of contact with the Jnanendriya, that is the sensory organs, and the Karmendriya, the motor components. So, it is described in Ayurveda that when the mind or the manas gets exhausted, it becomes inactive and there is a temporary loss of contact between this jnanendriya and the karmendriya, which results in a temporary state called as sleep. So Sharangdara, another scholar of Ayurveda, mentioned that nidra or sleep is a state where there is a dominance of Sharirika dosha, that is a kapha dosha. As you all know, there are three doshas, which is Vata, Pitta, and Kapha. So, out of the three doshas, it is the dominance of Kapha dosha and the Tamo dosha, which is one amongst the Sattva, Tama, Mano doshas. So, the dominance of these dual doshas will result in a state called as sleep. So, what else does this ancient science has to say about sleep? So, Ayurveda has given utmost importance to three things, that is the ahara, nidra, and brahmacharya. So, these trio are described as the tripod or the triopastamba on which the life is sustained. So, nidra is as important as ahara as per this ancient science. Also, it is told that there are certain vegas or urges which should not be controlled, which are told as adharaniya vega. This nidra or sleep comes under one of the urge which a man should not control. Also, it is claimed that nidra or sleep is swabhavika roga. So there are certain things like eating, sleeping, all these are inevitable. So after a certain interval, we will obviously eat. We can't eat. We can't stop eating, right? So similarly, sleep is also such a swabhavika or inevitable circumstance which a man has to undergo regularly. So it is also told that sleep is something which is the one which imparts the happiness, nourishment, and leads to the development in an individual. So, briefly, Ayurveda has categorized certain types of sleep. Although it is not clear cutly mentioned how exactly to differentiate different types of sleeps, still, based on their observations, the scholars in Ayurveda, they have said that there are six different types of sleeps. So the first one amongst it is a tamodbhava sleep. When there is a tamas increase, when there is a dominance of tamobhava, as I have mentioned earlier, so that results in the tamodbhava kind of sleep. As well as when the kapha increases, it leads to shleshma samudbhava variety of sleep. Another variety of sleep results when there is an exhaustion, physical as well as mental exhaustion, which is called as mana sharira shrama sambhava nidra. Another variety of sleep is the agantuki variety of nidra, which is due to external causes. It may be any external trauma or illnesses, which is agantuki and vyadhyanuvartini nidra. So these are the ones substantiating different varieties of sleep. And the most commonest variety of sleep is the Ratri Swabhava Prabhavajanya Nidra. So when it is the night environment, when after sunset, there is a soothing and a calm and a cool environment, which results in sleep. So we can find references regarding the pattern of sleep in different prakriti or different constitutions as per Ayurveda. All these references are scattered in different textbooks, which has been compiled together. To summarize, we may say that when a vata dominant prakriti, or when the constitution of the person involves a dominance of vata dosha, such a person will experience an irregular and a short duration of sleep. That person would benefit, although with more rest, as he is getting very less sleep. Still, the pattern of sleep in him is irregular and most of the time short. Also, it is observable that when there is a dominance of vata dosha, or the prakriti is more of vata, there will be certain kind of certain movements, such as teeth grinding, it may be the sleepwalking or sleep talking. All these are observable. It is not mandatory that it will always be present, but it is seen that some of the cases of vata prakriti will show these characteristics. Also, these vata type of people are very light sleepers, means to say they don't get very deep sleep, and they are easily, you can wake them up very easily, and it will be difficult for them to get back their sleep. Then it is a pitta dominance. When the pitta dosha is dominant in the person, when the prakriti of the person is pitta, he may experience not so deep sleep, but definitely a sound sleep. Also the amount of sleep is moderate, and but they often forego sleep when they are preoccupied. So falling back asleep after waking up in the night is not so troublesome in them. However, if their mind is overactive, if it is stimulated, if they are preoccupied with certain other things, then it will be difficult for them to fall asleep. Then it is a kapha dominant prakriti. When the person's prakriti or the dosha dominance is kapha, such people will experience a very deep and a sound sleep. And the sleep depth is also very good because of the mandaguna of kapha. So these people cannot be disturbed easily, they cannot be woken up easily. Also, they have a tendency of oversleeping, even though their body does not require such a kind of sleep. Coming on to the benefits and the function of a healthy sleep. So, properly and timely sleep will bring happiness, nourishment, the strength, knowledge, and maintains the life, says Charaka. Also, it will bring about a balance, or what we call as dhatu satmyata. So, dhatu samyata will be attained, an equilibrium of all the sapta dhatus will be attained if a person is getting a good amount of sound sleep. So it also increases the alertness, the vision, the complexion, the strength or the bala of the patient, also the agni or the metabolism of the patient. Also, people who intake proper sleep in a proper time will not suffer from diseases as per Sushruta. So their mind also will be peaceful. The strength also will be adequate in such people, says Sushruta. So if there is an improper sleep, it will result in disease, sorrow, malnourishment, weakness, and improper functioning of body and mind. Now, coming on to the concept of Ratri Charya, it is a set of guidelines which is being described by Ayurvedic textbooks, which is to be followed post sunset before the night hours. That is during the first three praharas of the night. So, prahara means 3 hours. So, during those time, what is contraindicated? The first 3 hours of the night is called as Sandhya Kala, post sunset. So during that time, it is told that the karmas or the activities like having food, indulging in sex, or sleeping, or even reading, or walking about is contraindicated during Sandhya Kala. Also, there are certain activities which is to be done post supper, that is brushing the teeth, walking 100 steps. It is always advisable after having food to walk 100 steps, which is being told by Ayurveda. Also, Samveshana is told by Ayurveda. So we have now seen what is a healthy variety of sleep, what are the different types of sleep, what are the benefits and what are the functions of having a good sleep. So along with that, if you just look at what is not normal or what is not healthy variety of sleep, we will look at it now. So the normal variety of sleep is naturally sleeping during the night time. So suppose if a person is not sleeping during the night time and keeping himself awake, then that particular thing is called as Ratri Jagarana. So the Ratri Jagarana or keeping oneself awake at night will increase the Vata dosha. And Diva Swapna is sleeping during the daytime. So if you are sleeping during the daytime, it will increase the Kapha dosha. So what can be done which can neither increase the Vata nor increase the Kapha dosha? There is a small concept called as Asina Prachalayana. So if a person is sitting and sleeping for a while without lying down, it is called as Asina Prachalayana, and it is said that by doing Asina Prachalayana, neither the Vata dosha nor the Kapha dosha will increase in a person. So, what this Ratri Jagarana can do by staying awake at night, if you look at today's lifestyle, most of them, irrespective of the generation, do not sleep up to 12 o'clock or up to 1 a.m. even. So, what will be the effects of prolonged Ratri Jagarana? So, if a person is keeping himself awake at night, it will just increase the Vata and Pitta dosha in the body, and as a result, the qualities of these Vata dosha and Pitta dosha, such as the Rukshata or the ability or quality which will just suck in the moisture or the it will result in depletion, will cause roughness of the body, and thereby the patient will start complaining. Patient or the person, even in healthy individuals, they'll start complaining regarding constipation, weakness. It may induce giddiness or difficulty in concentration. And when the Pitta dosha also is simultaneously increasing, it will result in hyperacidity, burning sensation of the eyes, hands, and feet, etc. And thereby there will be an increase of Vata and Pitta dosha. So, if a person, due to some unavoidable circumstance, he is staying awake at the night, then what can be done? So, he or she has to do is, suppose I have kept myself awake for 4 hours, then I can sleep for 2 hours the next morning before I can have my breakfast. So, if you can read the last sentence, due to unavoidable reasons, if the person has to keep himself awake at night, he should sleep during next morning half the amount of hours kept awake before having food. So, who are those people who are indicated to do night outs or keep awake themselves at night? So, the people who have the dominance of kapha, or people who are suffering with disorders of kapha, such as obesity. So, such people already have enough nourishment, enough dhatu, enough tolerance to maintain themselves even after they have a sleep deprivation, say for a day or two. Even in kapha people, it's not really ideal to stay themselves awake for a very long time. Still, for a certain while, it is okay. So, people with the kapha prakriti and the kapha disorders are indicated for Ratri Jagarana. So, it's the obese people. So are the people who are poisoned. And those people who are taking diet which is rich in fat, such people are indicated for this Ratri Jagarana. Then coming on to Diva Swapna. So what is this Diva Swapna? Diva Swapna is sleeping during daytime. What will happen as a result? The Kapha dosha will increase. So who are the ones who can actually sleep during the day? It is told that it is permissible up to one muhurta or 48 minutes. The special cases, special categories like the children, the aged, or the emaciated people, or those people who are regularly indulging themselves in strenuous physical activities. These alcoholics, although they are not indulging themselves in strenuous activities, alcohol itself is something according to Ayurveda which increases the Vata dosha. So such people and those people which have a reduced kapha, reduced rasa, are indicated for day sleep. Even in their cases, it is told that 48 minutes of day sleep is okay for them. And in conditions like indigestion is indicated for day sleep. If someone has indigestion, then he can sleep with, instead of having the breakfast, he or she can sleep for a while. Also, if you are looking at the Rutus, it is said that it is only the Grishma Rutu when a person is allowed to indulge in this day sleep. Rest of the Rutus, if you are indulging in day sleep in seasons other than summer, then it will again lead to the increase in the Kapha as well as the Pitta dosha. So, what happens if this Diva Swapna is practiced outside its limits, not within its limits? Then Ayurveda explains few of the diseases, few of the illnesses which are as a result of day sleeping, which includes again jaundice-like conditions, headache, numbness, feeling of heaviness, lethargy, loss of the Agni. Because once you are day sleeping, the Kapha dosha will increase and there is reduction in the Agni, or the digestive fire or the metabolism as such. The feeling of heaviness, edema-like features, influenza-like illnesses, itching, all of these symptoms which indicate the kapha dosha will start showing up once a person is regularly day sleeping. Now, coming on to the sleep disorders as per Ayurveda, as we have already seen the unhealthy sleeping patterns, we will look at whether some sleep disorders are told according to Ayurveda. So, very briefly and very shortly, they have beautifully explained sleep disorders. So, the scholars in Ayurveda suggest some of the sleep disorders like Nidra Nasha, Alpa Nidra, and Ati Nidra. So if you're looking at Nidra Nasha, as the word says, Nasha or the reduction in the Nidra or the sleep. So this is as a result of excess Vata and Pitta dosha. Now anything that can result in the Vata or Pitta dosha can be the etiology for Nidra Nasha. It may include the old age or the stress or any traumatic condition or any illnesses which can lead to the increase in the Vata and Pitta dosha and thereby leading to Nidra Nasha. As there is as the name says, it is the loss of sleep or the derangement in the quality as well as the duration of sleep. So what happens in Nidra Nasha? The person starts to feel lethargic. He starts yawning every now and then, stiffness in the body, some vague body aches, loss of orientation, some confusion, difficulty in concentration, drowsiness. All of these which are the symptoms of an increased vata dosha in the body are the symptoms of nidra nasha. So is alpa nidra, which is similar to nidra nasha, although there is no complete loss of sleep as in nidra nasha. In alpa nidra there is reduced sleep or it can be even disturbed sleep. Then it is the ati nidra. Ati nidra or excess sleep is as a result of increase in the kapha dosha, which will naturally lead to lethargy and increase in the alasata, and thereby increase kapha will be seen. And also obesity and associated illnesses will be the consequence of atinidra. Now coming on to the treatment, what can be done in case of nidra nasha? So based on the doshas involved, based on the stages at which the patients are coming with nidra nasha, based on based on their physical and mental statuses. Certain external therapies like abhyanga or massages, utsadana, it is another variety of abhyanga or massages. So samvahana is a gentle massage, and some applications to the forehead and head region, that is a shirolepa. Even simple techniques, simple regimens like taking bath, all of these will be suggested for nidranasha. And along with that, certain varieties of counseling, certain manasika upachara, such as addressing the fear or anxiety because of which the person is not getting sleep, their stress management, advising them to be happy, advising certain type of beds. All of these will be done in case of nidranasha. Also, certain lifestyle changes will be definitely indicated in case of Nidra Nasha, such as grapes or sugarcane or any sweet dishes made up of rice, meat soups or fish or buffalo milk. All of these will be indicated. Of course, all of these will be suggested only after looking at their health status and the associated comorbidities. Also, certain herbs and their herbal preparations made of Brahmi, Palandu, Tila, Kushmanda, Jatamansi, Tagara, Ikshu, all of these will be suggested, and all of this may be beneficial to certain extent. And then it is a treatment for Atinidra. So, Atinidra as a result of Kapha dosha. So, any treatment which can reduce the Kapha dosha can be suggested. It can be the panchakarma like vamana virechana, etc., or other treatments like the depleting therapies or langhana, or the sweat inducing therapies like swedana, or it can be the nasya, that is instilling certain strong nasal drops, or it can be certain applications like anjana. So integrating Ayurveda to rest of the modern methods to get good sleep. So some of the tips for this good sleep includes like maintaining a regular time. One must actually maintain a proper time for going bed. Also avoiding social media at night, avoiding smoking and caffeinating drinks before going to sleep. Not to indulge in any other type of work or reading till late nights. One should avoid stressful conditions, stressful thoughts before going to bed. If possible, some soft music, some favorite songs can also induce sleep, so it can be heard. Even a small prayer will help to get good sleep, or 5-10 minutes of just meditating will give a good sleep. And maintaining hygiene, of course, washing the hands, feet, and face will make you feel calm, clean, and it will definitely give you a good sleep. And avoidance of day sleep, excess coitus, proper evacuation of the bowels, and maintaining a certain privacy and a good environment for sleep will definitely be beneficial to get a good sleep. So that's it. This is a very small introduction of what Ayurveda has to say regarding sleep. Thank you for your patient listening.
Thank you, Dr. Kamala, for this crisp and clear explanation on Nidra, that is sleep, in Ayurveda. We will take up the queries that are in the chat box now. Can Pitta Vata people sleep during the day? Will yoga nidra also aggravate the dosha?
Um, yeah. So coming on to the question, can Pitta and Vata people sleep during day? See, it is not the right way actually. Day sleep is not something indicated for everyone. So as we have already discussed this, Vata and it is day sleep is not indicated for anyone basically. So only in certain conditions people can sleep during daytime. And even if you are sleeping during daytime, the status of the dosha. So apart from the prakriti, every person will have certain status of doshas which will vary as per your illnesses. So based on that only one can suggest if you can sleep during daytime. And
Yoga nidra.
yoga nidra is something which can bring about the equilibrium of the doshas or samadosha avastha. So I don't think it will be aggravating the dosha.
It will help in
Yeah,
getting sleep.
getting sleep. That's all.
Then, okay. Mention for oil massage to promote sleep in Vata predominant individuals, which oil is recommended?
Okay, simple oils like sesame oil is also definitely worth trying. Oil massage, especially for sleep in Ayurveda, when if you look at the text during the context of Abhyanga, it is told that Shira Shravana Padeshu Tam Visheshena Shile. So while applying oil, it is suggested that you can apply it on the Brigma, Shira, Shravana behind the earlobes, and the pada or the feet. So any kind of oil you can use. The simple and best option, whatever is available at home, you can use coconut oil or you can use even the jelly oil. So yeah, that will also provide a good sleep.
Is there any earliest time to go to bed at night, like 8 p.m.? Could you please elaborate?
Okay. See, there is no particular time that is mentioned as per the Ayurvedic science. Only thing one can suggest is yada tu manasi klante. So when my manas gets detached or it is tired enough, I am not able to concentrate on any other activities. That is when nidra sets in. That is what is told in the text. So when if it is 8 p.m. or 7 p.m., I am not able to focus anymore. I am done for the day. I am tired for the day. Then it is always suggested that you can go to bed. However, it is not advisable that you go to bed after 11 or 12 because after a certain duration during the Vata Kala also, if you are not sleeping, then it will definitely aggravate the doshas.
How many hours should be given gap before sleeping? Also, how many hours is recommended for individuals? Is it based on age? Please also specify the suitable timings for sleeping. Again, you said that particular time is
Yeah.
not mentioned in Ayurveda. It is good to sleep before midnight,
Yes.
early sleep, and early waking up is told. And how many hours should be given gap before sleeping? Gap from what is not clear.
Yes. Okay, if it is something related to food, then yes, after having food, it is advised that you walk for certain time for 100 steps, and it is always advisable that you give 1 to 2 hours gap after having the dinner.
Should sleeping patterns change according to season? If so, how?
See, season itself, if you look at the cold seasons, will induce sleep very early. If I'm right, when the environment itself is cold, you naturally get a good sleep. So, as per the text, day sleep, this seasonal pattern is told that too only for the Grishma Ritu or the summer season. But rest of the seasons, no such clear-cut rules or guidelines, set guidelines have not been told. So, as per the seasons, as per your doshas, it is primarily your doshas or your day-to-day status which decides your sleep pattern.
Could you please suggest best food or fruits that can be eaten before going to bed?
Yeah, fruits like grapes, dry grapes, it is told in the text. Also, you can try out some amla also, also the sugar cane. All of these can be tried out before going to bed. And milk definitely is always good before going to bed. Milk is suggested in Ayurveda. Also, it is been supported by the modern science as well. The tryptophan, which is a precursor for serotonin, which is present in milk, which is definitely good for your mood and also for your sleep.
I think I lost it.
Wait.
I think we are done with the doubts. Okay, so thank you everyone for your patient listening. Okay, there is one more question that has come up. If on waking up there is not freshness, would the cause be not enough sleep or anything else?
Yeah, one major cause for not not feeling fresh after waking up is definitely inadequate sleep. So in such cases also it's just that the next day the sleep will get compensated by itself. So that's what I can comment about it. Even after 7 months.
Okay, I think that is it. So every Saturday we'll have such sessions. Next month, I think there is one question on how often are these lectures. So every month you have one Saturday with these sessions. So please do log in and we will discuss on more Ayurveda topics that are more making people more familiar on Ayurveda. So thank you for your patient listening. Thank you, Dr. Kamala, for this
Namaste.
clear lecture.
Namaste. Can you hear me?
Yes, yes, I can hear you.
When I'm sleeping in the midnight, I feel like someone is waking me up. What happens that time? My nose gets blocks, and due to the blockage of my nose, I am restless to sleep more, or I wake up in the midnight. Like what on the time I will sit and do pranayama or the nose block which is blocked to me. I will do exhale on the nostril. Like this way it happens sometime. How to come out of this?
Ma'am, as you're telling it is a nose blockage during night, it is better to get evaluated what exactly is causing it. So without that, it is not, it won't be right from our part to comment at it. So if it is possible, you can come talk to us here. We are there at G13 at NIMHANS in the Department of Integrative Medicine. We have OPD running here Mondays, Thursdays, and Fridays. You may please come. We can evaluate you detailedly and we can suggest you some treatment for that.
Okay, thank you all.
Thank you, ma'am. Thank you.